Hello, good afternoon. Thank you for joining us in this afternoon for the webinar of Peter Registry. My name is Yadira Bravo. I'm the medical advisor of the ERN TransplantChild, and I'm really glad to introduce my colleague Miguel Clemente. He is our Helpdesk support here in the Technical Secretariat of the ERN TransplantChild. And we are going to talk about our ERN registry that is called Peter. I think that in the next 30 minutes, you are going to understand the added value of our registry here in the ERN TransplantChild. So thank you so much, and I'm giving the floor to Miguel Clemente.
Thank you very much, Yadira. Welcome to this webinar on the Pediatric Transplantation European Registry, or PETER for short. So this is the agenda for today. So we are going to briefly describe what the PETER registry is, the main aims of the registry and its added value, how the registry works, and what kind of data it is collected, who can access this data, how to introduce this data, and finally we're going to make a brief activity report of the current state of the registry. At the end of the session, there will be a brief time for question and answers, so feel free to leave any questions in the chat and we will go through them at the end of the meeting, or you can just speak up at the end of the webinar. So let's begin from the start. What is the PETER registry? So the Pediatric Transplantation European Registry is an online database that gathers information about patients across Europe who have received a pediatric transplantation. This registry integrates elements common to all types of transplantation, including both solid organ and hematopoietic stem cell transplantation, but also addresses other topics related to each of these transplantation programs. This platform not only gathers medical data, but also collects well-being feedback or quality of life data from patients and their families through the use of a complementary mobile application. The registry is originally intended for use by the members of the ERN TransplantChild, but it is also considered its use in other countries in the European Union. So what are the aims of the PETER registry? Well, PETER addresses the need for a whole understanding of pediatric transplantation by combining the multidisciplinary approach with the patient's own views about their progress and well-being. This approach covers the entire transplantation journey for pediatric patients, so starting from their inclusion in the waiting list to their post-transplant care. It is important to manage a comprehensive information about the transplantation journey, since this will enable TransplantChild to achieve the following objectives. So to assess the long-term efficacy and safety of the transplantation, to evaluate clinical outcomes, including graft survival, complications, patient survival, and so on, to assess the quality of life of pediatric transplant recipients, to correlate the changes during the transplantation process with the patient's quality of life, to identify areas for quality improvement and harmonization of clinical practice, and to support the knowledge generation on pediatric transplantation process and the promotion of research. So by fulfilling these objectives, PETER aims to improve the care and outcomes of pediatric transplant recipients. So back in 2021, when the PETER registry was just a project before it actually began as a data collecting platform, a study was performed to identify which were the needs in the pediatric transplantation registries in Europe, and both at national and international level, with the aim of determining the registry opportunities and to establish a clear strategy to carry out this PETER project. So information on a total of 27 registries was collected and analyzed. And this analysis was performed to study the registry's gap and opportunities in Europe, and two main conclusions were drawn. So the first one is that very few registries combine both solid organ transplantation and hematopoietic stem cell transplantation data. And since TransplantChild has a transversal view on the process of transplantation, this is a clear opportunity to develop a registry that integrates both types of transplantation data. And the second conclusion is that the main gap in terms of information contained in the registries corresponds to quality of life data. This is a very important aspect for transplant child patients that unfortunately is difficult to measure, and that is why registries usually do not include this information. So it is necessary for a new registry to be successful to include quality of life data to satisfy these needs. As a fact, this only registry that collects quality of life information that was studied was ERCOREC, so the registry for the ERN ARCnet, that follows the same suggestions of the European Commission and the ERICA consortium. So what is the value proposition of the Peter registry? Well, Peter provides several important benefits, such as the integrated approach in transplantation, that since it gathers patient-based data to enhance medical processes and understand the holistic impact of transplantation on patient well-being. It enables informed decision-making by tailoring care to individual needs. It improves post-transplant strategies, aids research for long-term outcomes, and assesses transplantation for effectiveness for quality improvement. So what are PROMs? PROMs stands for patient-oriented, patient-reported outcome measures these are valuable indicators of care quality and outcomes that are relevant to patients, encompassing their physical, mental, and social well-being. These are standardized, validated surveys that patients fill out during the perioperative phase to gauge their views on their health status, perceived impairment levels, disability, and quality of life related to health. The integration of PROMs with clinical data allows to detail a patient's overall state, detect early signs of disease and monitor its progression, evaluates individual needs of patients, develop strategies for treatments, provide patient-based data for quality improvement projects, and improve communication between physicians and patients. This is a brief scheme of how Peter works. So basically, the information is uploaded to the registry from two different sources and at different time steps of the transplantation process. So there is a part of the information that is prior to the transplant, that is mainly the general information about the patient. There is information about the transplant procedure in itself, so not only the procedure, but also the pre-transplant information, which is commonly known as the waiting list information. And different information is also asked in the follow-up sessions that follow every transplantation procedure. And this clinical data that is introduced at these different steps is complemented by the information reported by the patients through the Peter app mobile application that is asked right before the transplantation procedure is carried out, so to evaluate the patient state before the procedure, and then once for every follow-up session to evaluate their progression after the transplantation. So in each of these steps, different information is collected. So regarding the patient information, it basically contains the basic data for the patient, such as the ID and other personal information. During the transplant information, waiting list information is recorded, as well as information regarding the transplantation procedure itself. And for the follow-up sessions, there are actually 3 questionnaires regarding the post-transplant information. So information about the current status is asked. Also, any complications after transplantation that may have arise. And finally, lab and functional test information. And as regarding the amount of data collected, the Peter registry is quite big. So it has around 350 variables for each patient. This table shows the number of mandatory variables per questionnaire, because not all variables are actually mandatory. And it is also important to notice that some variables are transplantation program specific. So obviously, no patient is ever going to have all 350 variables answered for them. So this is a brief summary of how many variables you could expect to actually need to fill in for each for an individual patient. So all in all, it depends on the transplantation program, and of course it may be a bit more complicated if the transplantation is a combined one, but it is real to expect the number of variables to be a bit less than 100 for each patient. And regarding the other side of the data that is collected, we have the Peter TransplantChild mobile application. It is both available for Android and iOS, and it aids patients in completing specialized and validated well-being questionnaires. So these questionnaires are the PETSQL questionnaires designed by MAPI Research Trust. And these are designed for children or parents to self-assess and report their perspective on their health, well-being, and overall progress in the entire process of receiving the new organ. Of receiving their new organ. These questionnaires are adapted for serving children across various age groups and to serve throughout the whole transplant process. For each patient registered in Peter, either the patients or the parents, in case they are too young, will receive an advice to the mobile application to fill in the questionnaire. In order to access the application, they will need a password that can only be generated by their doctor through the web registry. And the app will automatically generate the relevant questionnaires to the patient, depending on the patient's age, transplant phase and transplant type, and of course, the language. Periodically, patients or parents or caregivers, whoever is responsible, will be reminded to respond to the forms, and the data will be automatically updated on the Peter registry, where the physician or the clinician in charge of the patient will be able to assess their answers. So, okay, so we have just uploaded a whole lot of information on the Peter registry. Now, what worries me is who has access to this information. So the owner of the Peter registry is the ERN TransplantChild, but the ERN does not have a legal entity. So the Foundation for Biomedical Investigation of La Paz University Hospital, or FIPHULP, is the administrative and management structure to manage the European project under the supervision of La Paz University Hospital. Of course, the clinician that uploads data on a patient has access to that data, and their HCP acts as a data controller. They can also access aggregated information regarding the overall content of the registry. And the Peter Consortium has established a data access policy that delineates authorized users, the types of data that can be requested, the stakeholders eligible to request data, and the associated procedures to request the data. There is a dedicated data access committee that has been proposed to handle these requests, promoting research using the data collected from the Peter registry, while adhering to existing the data protection regulation. So the government of the Peter registry and the different committees can be accessed in a document called the Terms of Reference, which I will be talking about in a moment. How can I participate in the Peter registry? Well, the Peter registry can be accessed either from the TransplantChild website or from the own Peter website. It requires login credentials that are provided by the technical secretariat. So if you are in need of credentials, please let us know. Currently, only one account per transplantation program is provided. But the most important thing is that prior approval to participate in the registry is needed. This approval needs to be given by each center's local ethics committee. So it is really important that you contact your local ethics committee, because unfortunately we cannot contact each individual one, since all of them work independently from each other. Once contacting the local ethics committee, they will require a bunch of documentation depending on the regulation, and all all these useful documents can be can be found in the TransplantChild Helpdesk Peter website. And of course, we always remain available should you need us for any kind of help regarding this process. So these were the documents I was mentioning just a moment ago. So you can access them through the TransplantChild Helpdesk website. And these documents are mainly the terms of reference, which is the organigram that defines the organization, roles, responsibilities, and so on regarding the Peter registry. The registry protocol, which is available in different languages in the European Union, and contains useful information on how the registry works and under which conditions can a patient be or be not included in the registry. Just as a disclaimer, even though the protocol is available in, I believe, all at least all the languages from the members of the ERN TransplantChild, only the language one is actually validated. So if you are going to use the other one, the translated version, please make sure that the translation is consistent with the English version. The data access policy is also available in this platform. This is a document that establishes the condition for sharing data and to whom it is possible and are we allowed to share the data with. The data request form, data sharing agreement, transfer agreement, the data request feedback, and the Peter dataset, which is especially interesting for people that are interested in participating but do not have the approval yet. So as they know what to expect from the registry. And of course, the informed consent forms that can be found somewhere in another different web page. So the consent web page of TransplantChild, and these are also available in the languages of different country members. Okay, this is very useful, but we know that you as doctors are already participating in a number of registries, and a new registry would mean some additional work. So we are aware of that. And in order to determine the registry with which there should be data sharing, we a couple of months ago we launched a survey to recruit the help of the different transplantation programs to recapitulate the different transplantation programs that each of you are reporting to. So the aim is to update the registry source map and to make Peter Registry able to share data with the main registries that you are already working with, both nationally and internationally. So this link here goes to the survey. So please, if your transplantation program, if you are aware that your transplantation program has not yet participated in this registry, please make sure you fill it in. It takes less than 5 minutes and is a necessary step in order to build the intercompatibility of the registry. This figure shows the number of transplantation programs that report to each registry. So it was built with the data we have collected so far. As I said, we are still missing some transplantation programs, so please make sure that you fill it in. And with the data we received so far, we have found that there are at least 21 different international registries and 21 national registries that are being actively used by ERN members. So there are some common registries that many transplantation programs use, such as the other ERN registries, such as ERCREG for kidney or rare liver for liver transplantation programs, the CERTAIN or the EBMT at European level, and then other registries at national level. But as you can see, there are a whole lot of other registries, both nationally and internationally. And as I said, there are over 40 different registries, and we are expectedly missing some. So it may take some time to actually build an intercompatibility with all of them. Finally, a brief activity report. Last update was made today, so the data is pretty new. In this activity report can be found at any time at the Peter website. And you can find information such as the number of centers that are participating in the registries, number of registered patients, number of registered transplants, and the individual number for each type of transplantation. This report, at the moment, most of the data corresponds to kidney and liver transplantation, but Peter has data of all kinds of transplantation, both solid organ and hematopoietic, and included as well some combined transplants. So, to summarize, Peter added value lies in its holistic approach to pediatric transplantation. By addressing the common and specific elements of each transplantation type and integrating them with the quality of life data reported directly by the patient, it helps professionals understand not only the medical aspects of the transplantation, but also how it affects the patient's overall well-being. So now you may see this as your your take-home homework. Peter is a fundamental activity of the ERN. So we expect all of the members to participate in the registry at some point. So why not begin as soon as possible and aim to have participation from all ERN members by the end of this new project, which would be 2027. And as I said before, it is very important. The first step is really important that you contact your local ethics committee to ask about the requirements to participate in a European registry. It is necessary that you are aware of the requirements because, as I said, each ethics committee operates different to the other one. So even at national level, different ethics committee operate in a different way, and we are open to help you from the technical secretariat. We are always open to help you, but we cannot help you if we do not know exactly what your ethics committee requires. And finally, I couldn't close this presentation without mentioning our colleagues that participated in the development of the Peter Registry. So many thanks to Professor Wemberg from Karolinska University Hospital, to Professor Kalisinski from the Children's Memorial Health Institute, to Professor Perilongo from Padova University Hospital, and everyone in their teams, and the team obviously at the team at La Paz, and everyone else that was involved with the project. So thank you very much for joining us today in this presentation.